Wakwaba na yenhwe serious 70 mo ankasa etie yeko na Kolebu Teaching Hospital ho na yefri yenkase no ase panifo eda no de aba betu dwa se yade a yenhunu se mu oden pa yakase bia emergency cases no ene de enyade se wo mo ebeji bie na wotwemienu a eda ye ni mo no fi se wadwuma yefo no mu bi ewo ho a Covid-19 no bi atwe wo mo enu nti yade a yenhunu Sanu odinti e wose empofrimu na yeboa wo mo non emergency cases na de 2 weeks de Kolebu aban ayaresabia mpanifo se won mo anyi bi sesei Adom TV kase etoso
ayaresabia mpanyinifo a wonom ewo Kolebu aban ayaresabia edenkrata ababeto montene so a wonom echiremu se sesei na wotwemienu entemu no emergency surgical cases nkoa na wonom ebeye ewo wonom ayaresabia honom yenti a wonom asisi agina ye nyina egina se wonom adwumayefuo binom enya Covid-19 yare ni bi enu nti no se agina ye ebeboa ama wonom atimi abo enipa a wonom ani wondi dwuma ho ban na afi apomodin adwumayefo a wonom aka no so watimi abo won ho ban na wanya hoden ahwe ayarefo a wonom ewo ayaresabia honom no chiremu a saa adwumadi a wonom atwe asensen ebeboa wonom ama watimi aboabo won ho yie sene ebeya wobetimi asan ahye wonom adwuma asibiom na emum saa biri de enipa ehuhia sene manimu ya no ebema wonom empomuden na wobehwe wo mo enkrata animu no wonom ede adesrade ato ayaresabia hodo a aka nina animu se sesei ade se obi a wohia sene manimu ya no wonom be ne surgery anase obekọ ENT maxillofacial anase obstetrics department nkoa na wonom ema ne referral ema ne Kolebu aban ayaresabia honom nemum emiania aka ewa yaresabia ho ne de wonom da ho a eye adwuma Sa enkratai Mustafa Salifu ya oya head of public relations ewo Kolebu aban ayaresabia ena nensa eshasi
to suspend non-emergency and urgent cases for the next 2 weeks. There are reasons for this. One is to protect our clients and patients, and then 2, to also protect the rest of staff who are still at post and then providing care to patients.
How many of your staff have been infected with COVID-19?
As of last week, we have about 91 staff members who are infected with the disease, and then we are still working, but within the circumstances, we thought it wise to scale back so that we will not expose our patients, and the other reason for which we work here.
Did you say 91?
Yeah, 91, yes.
And this latest one, which has informed the decision to suspend non-emergency services, how many are we looking at?
It's not the latest. We are looking at the cumulative figures that we have received, and that is why we are taking this decision. We have staff who are critical to the care that we provide, particularly the surgical interventions that we do in the hospital, and if a good number of them are exposed, it is only fair and proper for us to scale back and use those who are not affected to still provide the care to the dire emergencies. So we are calling on sister hospitals not to refer the non-emergency and urgent cases. They should try and refer to other appropriately equipped facilities within the metropolis to handle that whilst we observe this period of suspension for the next 2 weeks.
So over the period, that is by end of June, you had 91 of your workers infected with the virus, correct?
Yes, as at last week.
How many have been asked to go into quarantine? I'm sure you did contact tracing. So out of this 91, we know the 91 for sure they are on isolation. How many have been asked to go on quarantine?
When you are affected, out of this 91, remember some of them have been treated and discharged and they are back to work. And then if you want the exact numbers, I'll have to check on that and then get back to you.
So how many of the units have been affected in this whole development of COVID outbreak here?
No, for what we are saying now, the surgical interventions, all of them will be affected in that. So you have the ENT, you have the general surgery, the main surgical block will be affected, ENT, pediatric surgery, accident and emergency obstetrics will also be affected.
Yanto Kasee no so na wo COVID-19 ne ho nsensem nti no brano so ye hwe ya pom den ho nsem so na Ministry of Information hia na fe wo mo aka de ekoso ache yansa kra na se Kwasi Davidu na mampani so de ne de beba wo de aba ene wo mo ahia ye na Ghana Health Service mpanifo kasa sedakro cases a ye record wo man Ghana mu no e wo soro do 400 na we ne de pefe senhye da ho CM Famoye hu ban no na Ghana fo bu nuagu ya sumo Director General eda Ghana Health Service ano Dr. Patrick Kumabwaje de ensemi etudwa sabra ba betudwa se Senior Minister Uraya Osafoma Fumpo yade ni bi atre no.
While conducting affairs of state from the presidential villa of the Jubilee House. Today I think will be day 3. The President has been conducting state business via telephone and other technology, and has been in particular following up on the COVID response program, as well as the broader 2020 work plan of his administration. We are thankful to all for the best wishes to him. In a separate development that has come to us this morning, Senior Minister Osafo Mafo has been informed that his sample given for test has returned positive. He will therefore, as of today, commence treatment for COVID-19 from home. And in consonance with the transparency that we're bringing to this, he has instructed that we inform the general public of this accordingly. Our best wishes remain with him and all who are battling the virus, and we continue to encourage strict compliance to the preventive etiquette, particularly social distancing and the wearing of masks. These are proven ways to cut the rate of spread, and we admonish all to observe them. Government is committed to doing its part by providing more and more public education, logistics, stepping up enforcement, but we as citizens also have a responsibility to protect ourselves too. The ones that government cannot do for us, we must do for ourselves. Dr.